Maternal death scandal. Severe maternal morbidity, often referred to as near miss or near death. A study from 2014 shows that compared with white European women, black African women are 83% likely and black Caribbean women are 80% more likely to suffer a near death. Antenatal care. This is the care you receive while you are pregnant to make sure you and your baby are as well as possible. The midwife or doctor providing your antenatal care will check the health of you and your baby, give you useful information to help you to have a healthy pregnancy, including advice about healthy eating and exercise. Neonatal care. Neonatal means newborn, or the first 28 days of life. Over 90,000 babies are born premature or sick and in need of neonatal care in the UK each year. Perinatal care. Perinatal is the period of time when you become pregnant and up to 1 year after giving birth. You might also have heard of the following terms: antenatal or prenatal, meaning before birth, postnatal or postpartum, meaning after birth. Systematic racism within the UK maternity care. Systematic racism within the UK maternity care is risking the safety of people from black, Asian and mixed ethnic backgrounds, often with devastating consequences, according to a report by the childbirth charity Birthright. Guardian newspaper article on the 23rd of May 2022. Channel 4 dispatches. Presenter Rochelle Humes demands action over the shocking disparity of maternal deaths between white and non-white women. According to the latest figures discussed in Channel 4 dispatches, black women are just over 4 times more likely to die during pregnancy and childbirth and up to 6 weeks postpartum. Aired on 8 p.m. on Monday the 29th of March 2021. All-Party Parliamentary Group on Black Maternal Care. The APPG aims to raise awareness of the issue of racial disparities within the maternal health care and offer a solution to this end. Chair, MP Bell Ribera Addy, MP. Vice Chair, MP Caroline Noakes, Conservative. Vice Chair, MP Florence Eshilome, Labour Cooperative. Vice Chair, Kirstin Oswald, MP, Scottish National. Vice Chair, MP, Marsha Dakova, Labour. Vice Chair, MP, Kim Johnson, Labour. The Southwark Council Maternity Commission. The Commission panel members include Councillor Evelyn Koto, Chair, Professor Dame Donna Kinnair, Co-Chair, Dr. Benedicta Agiwawe Osuri, Omar Campbell, Sandra Ikwe, Jackie Kempton and Cheryl Rhodes. Southwark Council Maternity Commission. Councillor Evelyn Koto, Southwark Council's Cabinet Member for Health and Wellbeing, formed the commission to hold meetings, listening exercises and ways for women and families to share their experiences, raise community awareness about having a safe pregnancy and birth, bring about changes in maternity care to help reduce maternity inequalities such as maternal deaths during pregnancies, provide a message of solidarity to the people of Southwark. Southwark Council Maternity Commission. Who do we want to hear from about maternity care? People living in Southwark who've had a pregnancy in the past 5 years and their families. People who have worse outcomes in pregnancy and childbirth, including those from Black, Asian or minority ethnic backgrounds, white residents on lower income, asylum seekers and refugees, those living with long-term conditions and or disabilities, frontline professionals delivering maternity and or postnatal care in Southwark. The Black Maternal Death Scandal. Get involved. Let your voice be heard. The Motivator Show. The internet's most inspirational podcast. Subscribe to our YouTube channel. It's free. Press the like button and don't forget to leave a comment. Follow us on Facebook. Give us the thumbs up and share with your family and friends. We are also on Instagram and TikTok. Follow us there too. The Motivator Show. Translate our words into action. The internet's most inspirational podcast. The Motivator Show. The Black Maternal Death Scandal. Severe maternal morbidity, often referred to as near miss or near death. A study from 2014 shows that compared with white European women, Black African women are 83% likely and Black Caribbean women are 80% more likely to suffer a near death. Antenatal care. This is the care you receive while you are pregnant to make sure you and your baby are as well as possible. The midwife or doctor providing your antenatal care will check the health of you and your baby, give you useful information to help you to have a healthy pregnancy, including advice about healthy eating and exercise. Neonatal care. Neonatal means newborn, or the first 28 days of life. Over 90,000 babies are born premature or sick and in need of neonatal care in the UK each year. Perinatal care. Perinatal is the period of time when you become pregnant and up to 1 year after giving birth. You might also have heard of the following terms: antenatal or prenatal, meaning before birth, postnatal or postpartum, meaning after birth. Systematic racism within the UK maternity care. Systematic racism within the UK maternity care is risking the safety of people from Black, Asian and mixed ethnic backgrounds, often with devastating consequences, according to a report by the childbirth charity Birthright. Guardian newspaper article on the 23rd of May 2022. Channel 4 dispatches. Presenter Rochelle Humes demands action over the shocking disparity of maternal deaths between white and non-white women. According to the latest figures discussed in Channel 4 dispatches, black women are just over 4 times more likely to die during pregnancy and childbirth and up to 6 weeks postpartum. Aired on 8 p.m. on Monday the 29th of March 2021. All-party parliamentary group on black maternal care. The APPG aims to raise awareness of the issue of racial disparities within the maternal health care and offer a solution to this end. Chair, MP Bell Rubora Addy, MP. Vice Chair, MP Caroline Noakes, Conservative. Vice Chair, MP Florence Eshilome, Labour Cooperative. Vice Chair, Kirstin Oswald, MP, Scottish National. Vice Chair, MP Marsha Dakova, Labour. Vice Chair, MP Kim Johnson, Labour. The Southwark Council Maternity Commission. The Commission panel members include Councillor Evelyn Koto, Chair, Professor Dame Donna Kinnair, Co-Chair, Dr. Benedicta Agiwawe Osuri, Omar Campbell, Sandra Ikwe, Jackie Kempton, and Cheryl Rhodes. Southwark Council Maternity Commission. Councillor Evelyn Koto, Southwark Council's Cabinet Member for Health and Wellbeing, formed the commission to hold meetings, listening exercises and ways for women and families to share their experiences, raise community awareness about having a safe pregnancy and birth, bring about changes in maternity care to help reduce maternity inequalities such as maternal deaths during pregnancies, provide a message of solidarity to the people of Southwark. Southwark Council Maternity Commission. Who do we want to hear from about maternity care? People living in Southwark who've had a pregnancy in the past 5 years and their families. People who have worse outcomes in pregnancy and childbirth, including those from black, Asian or minority ethnic backgrounds, white residents on lower income, asylum seekers and refugees, those living with long-term conditions and or disabilities, frontline professionals delivering maternity and or postnatal care in Southwark. The Black Maternal Death Scandal. Get involved. Let your voice be heard. The Motivator Show. The internet's most inspirational podcast. Subscribe to our YouTube channel. It's free. Press the like button and don't forget to leave a comment. Follow us on Facebook. Give us the thumbs up and share with your family and friends. We are also on Instagram and TikTok. Follow us there too. The Motivator Show. Translate our words into action. Inspirational Podcast. The Motivator Show. The Black Maternal Death Scandal. Severe maternal morbidity, often referred to as near miss or near death. A study from 2014 shows that compared with white European women, black African women are 83% likely and black Caribbean women are 80% more likely to suffer a near death. Antenatal care. This is the care you receive while you are pregnant to make sure you and your baby are as well as possible. The midwife or doctor providing your antenatal care will check the health of you and your baby, give you useful information to help you to have a healthy pregnancy, including advice about healthy eating and exercise. Neonatal care. Neonatal means newborn, or the first 28 days of life. Over 90,000 babies are born premature or sick and in need of neonatal care in the UK each year. Perinatal care. Perinatal is the period of time when you become pregnant and up to 1 year after giving birth. You might also have heard of the following terms: antenatal or prenatal, meaning before birth, postnatal or postpartum, meaning after birth. Systematic racism within the UK maternity care. Systematic racism within the UK maternity care is risking the safety of people from black, Asian and mixed ethnic backgrounds, often with devastating consequences, according to a report by the childbirth charity Birthright. Guardian newspaper article on the 23rd of May 2022. Channel 4 dispatches. Presenter Rochelle Humes demands action over the shocking disparity of maternal deaths between white and non-white women. According to the latest figures discussed in Channel 4 dispatches, black women are just over 4 times more likely to die during pregnancy and childbirth and up to 6 weeks postpartum. Aired on 8 p.m. on Monday the 29th of March 2021. All-Party Parliamentary Group on Black Maternal Care. The APPG aims to raise awareness of the issue of racial disparities within the maternal health care and offer a solution to this end. Chair, MP Bell Rabo Addy, MP. Vice Chair, MP Caroline Noakes, Conservative. Vice Chair, MP Florence Eshilome, Labour Cooperative. Vice Chair, Kirstin Oswald, MP, Scottish National. Vice Chair, MP Marsha Dakova, Labour. Vice Chair, MP Kim Johnson, Labour. The Southwark Council Maternity Commission. The Commission panel members include Councillor Evelyn Koto, Chair, Professor Dame Donna Kinnair, Co-Chair, Dr. Benedicta Agiwawe Osuri, Omar Campbell, Sandra Igwe, Jackie Kempton and Cheryl Rhodes. Southwark Council Maternity Commission. Councillor Evelyn Koto, Southwark Council's Cabinet Member for Health and Wellbeing, formed the commission to hold meetings, listening exercises and ways for women and families to share their experiences, raise community awareness about having a safe pregnancy and birth, bring about changes in maternity care to help reduce maternity inequalities such as maternal deaths during pregnancies, provide a message of solidarity to the people of Southwark. Southwark Council Maternity Commission. Who do we want to hear from about maternity care? People living in Southwark who've had a pregnancy in the past 5 years and their families. People who have worse outcomes in pregnancy and childbirth, including those from Black, Asian or minority ethnic backgrounds, white residents on lower income, asylum seekers and refugees, those living with long-term conditions and or disabilities, frontline professionals delivering maternity and or postnatal care in Southwark. The Black Maternal Death Scandal. Get involved. Let your voice be heard. The Motivator Show. The internet's most inspirational podcast. Subscribe to our YouTube channel. It's free. Press the like button and don't forget to leave a comment. Follow us on Facebook. Give us the thumbs up and share with your family and friends. We are also on Instagram and TikTok. Follow us there too. The Motivator Show. Translate our words into action. The internet's most inspirational podcast. Oh, all right. Yes, it's the Motivator Show. This is where we translate our words into action, and where success, is ours for the taking. How are you feeling, people? How are you feeling? This is the Motivator. I'm feeling good. I'm feeling alive. I'm feeling vigorous. Oh, I hope you're feeling the same way too. Oh yeah. I let that pre-show video run a little while because it sets the context, the purpose for this particular transmission. This is going to be an important podcast. It'll be an informative podcast. It's ones that will not only inform, but it will inspire. It will inspire you to take action. We are not going to sit idly by and let actions occur to us without our appropriate response. Oh yeah. But anyway, let's get this podcast, let's get this show on the way, shall we? Okay. First of all, I want to give a big thumbs up. There we go, get it on the screen now. A big thumbs up to Ian King from GalaxyAfiri.net. He's taken us from night to day. Let's give a big shout out to Ian King and to the management of GalaxyAfiri.net. I trust you are all well. I trust you are all well. And I know listening to GalaxyAfiri.net, you're inspired. The brainwashing, none of it foolishness you hear on these other platforms. Here, you get the real McCoy. But of course, this particular show, this podcast, goes out on many platforms simultaneously live. I'll put that up on the screen, shall I? Just so you all remember where you can find us. So of course, Those of you on galaxyaffiliate.net can hear my voice, and indeed, it's an all right voice, isn't it? It's an all right voice. But of course, you can both hear and see my personage on YouTube under The Motivator Show. You can see my action, always those actions, yeah? You can also see me on Facebook, again under The Motivator Show. Yep, that's where I can be found, YouTube and Facebook. Also now on Instagram, you can see I'm live on Instagram. Oh yeah. And of course, you can also see the after excerpts on TikTok too. And those of you who, for whatever reason, are not on galaxyaffiliate.net audio only, and of course, you can hear myself audio only on Mixcloud as well, on the Motivator Show. There you are. So those are the various platforms. More will be added over the coming weeks and months, and they're just being prepared as we speak. So there you are, a multi-platform transmission, and that's for good reason, because the quality of our content is sought after by those across the world. I've noticed across our social media platforms, our numbers are going up exponentially, and I thank you for your support. I approve of that support. Thank you. It's clearly evident that the content is relevant to you. Long may you enjoy it. Share with your family and friends, your networks, your business contacts. Share these messages with your friends. Nevertheless, there is important work to do. Important work to do. And that work is about ensuring the appropriate information is shared with the audience. Okay? I pause there because this show will be rather heavy. Okay? It will be quite heavy. It will be a show that some people will be saddening and trigger some people. I get it, because we are concerned with maternal health. Yeah, pregnant women. Yeah, women who have children. Yeah, it is going to trigger because I've got cause for concern. Okay, and that will percolate. You'll see it through the show why I have cause for concern. Okay, if you've got daughters, yeah, if you've got nieces, you've got cousins, yeah, if you've got sisters, yeah, as a man, you know this is a show you must pay attention to. And if you are a woman, look, pay attention, because we need your attention and we will need your proactive involvement. I'll get to that soon. But before I go to any of that, I want to first of all congratulate and thank what was a exciting, insightful, powerful show of our last Saturday. It was truly powerful. I want to thank Tony Nandi and Ndidi Ishiwa, yeah, of Ninas. Yeah. What is happening in Nigeria is a concern to us all. And they were able to outline to us a path to peace and prosperity. I can only hope, I can only pray that the Nigerian government heard and watched that transmission. I can only hope and only pray that all the communities of Nigeria, yeah, whether you be Igbo or Yoruba, yeah, whether you be Hausa or indeed be Fulani, yeah, as the 3, 4, 5 principal communities there. I can only hope you heard the transmission. I've had quite a few feedback to last Strong show, and I've got to tell you, some was very helpful, some was disturbing, others were just wanting to understand even more so, and for that reason there'll be further episodes in the life and time of the country we call Nigeria. Okay? It's an important country in the wonderful plethora of issues that we've got to tackle. But Nigeria is one that we've got to tackle. We must not be afraid to talk about the internal situation in that country. We must not be afraid. We must focus and be solution finding. Focus and be solution finding. I want to thank Tony and Nyandi. I want to thank Ndidi Ijiwa for their presentation last strong. What a powerful group of people they are. And long may your works continue. All righty, but thank you for that. And congratulations on you later on. And now we get to the next segment of this show, which of course focuses on us. Yes, us. Our shows about us internally, our bodies, yeah, our minds, our spirits. I want to focus on that aspect of who we are. Okay? Because this is an issue that we must talk about. It's an issue of concern to every one of us. No matter how healthy or fit you are right now, within our families, the levels of illness, the level of unfitness, the levels of obesities are way off the scale. And many of you who are aware that I'm also an elected official will be aware that I see the official figures, even if I didn't want to see them. If I wanted to be in denial, I see the figures and they make for uncomfortable reading. So I'm going to spend a few minutes and focus on our lifestyle. And I hope you all understand why this is a responsible part of the show. Yeah. I say responsible deliberately to highlight the fact that if we are to be transformative, we must talk amongst ourselves, discuss these issues. Yeah. And then we work together. Yeah. A family that works together grows together. Yeah. A family that works together grows together. We need to grow together because this is serious business. I pause there and I can see a few of the flashes. I see those on the messenger. I see you. Don't you worry. I see you. But I'm going to start with our lifestyle messages. And I need you, please, to pay attention. Okay? Pay attention. Okay? Pay attention. Because the messages are very simple, but require you to apply some will, some thought, some intention that you want to live a long, healthy life. But there are aspects of our cuisines, of our lifestyle, that we need to change, we need to improve for ourselves, for our husbands and wives, our partners' sake, for our children's sake, for our nieces and nephews, our cousins, our friends, our wider community network. There's some aspects we need to change. And let's begin. I ask you to consider the amount of sugar and salt that you consume each day. Yep, those basic ingredients, sugar and salt that you consume each day. Didn't say stop it. I simply said consider, and thereby consider reducing the amount of sugar and salt that you consume each day. Sugar, one of the primary causes of diabetes in our community, where the pancreas secreting insulin, we become numb to that insulin. So we're not processing the sugar, which leads to diabetes. And it is devastating for many who have diabetes. In every other family in the Black or African communities, here in Britain, and most certainly in the Caribbean and America, United States of America, diabetes is a prevalent condition which has to be managed artificially, and it is avoidable. The overconsumption of sugar is a big problem in our community. Equally, the overconsumption of salt in our community is a problem. Yeah, the hardening of the arteries, and causing the heart to have to pump with even greater vigor. Okay, and thereby raising our blood pressures. Each of you will know someone with either diabetes or high blood pressure or hypertension, as the clinicians would describe it. It is a big issue. It is avoidable. It's very much to do with our lifestyles. So I ask you to consider the amount of sugar and salt that we consume each day. I no longer buy sugar or salt from the grocery stores because there's more than sufficient sugar and salt in my food, I have found. There's more than sufficient. And it's usually the same. I believe you will find it is transformative. That's the good after first, of course. I equally ask you to consider the amount of carbohydrates that you consume each day. Typically, in our case, we derive from wheat-based products. Yeah. In other words, the bread, the pastas, and so on. But equally, from root vegetables such as the potatoes and the yam. Yep, the potatoes and the yam. I know in some communities, yam is a staple food you've eaten all your life. That's fine. But there are far too many Africans for which yam is not a staple food. Yeah. And it's overconsumption of what is not a typical part of your cuisine from a child that then becomes the problem. Because we're going to talk about obesity, in other words, fatness, overweightness in the community in a moment. But yes, carbohydrates, the overconsumption of carbohydrates and what it does to our bodies is an issue that we do not discuss. And we will discuss on these podcasts every strong. Because we must not be afraid to discuss that which has a profound impact on our bodies, our physiologies, our minds, and of course, our spirits. I ask you again also to consider the amount of fat that you consume each day. I know this is a profound one. Here on the screen, you can see the meat, raw meat, but you can see the meat and you can easily determine where is the fat. The fat is all the white streaks in the meat. Yeah. When you see the clear fluid, when you grill meat, you see that clear fluid. Yes, it's water, but an enormous amount of fat is contained in it. And what do our bodies believe when you're consuming this much fat? That it need to store it for a rainy day, for when you are going to be starved, yeah, when there's famine. Yeah, we consume far too much fat, with a consequential impact upon our bodies. So I ask you to consider the amount of fat that you consume each day. Yeah, it is a profound observation that we all consume far too much fat, unnecessary fat. And of course, the impact is not always obvious. Here on the screen, you see an example of an artery that is partially clogged, usually with hardened the carbohydrates and fats and other ingredients is being hardened and restricting blood flow. You can see the restricted blood flows. Yeah. So when you have in your extremities, in other words, your limbs, yeah, you're feeling tingling when it doesn't seem to function as well, when it's feeling numb, it's usually the result of restricted blood flows, which is directly attributable to your lifestyle, what you consume every day. So I want you to pay attention to this part of the video because you can see what is actually happening on the inside of our bodies and therefore a potential heart attack. Another ingredient that I want to give light to, the last ingredient, is starch. It's not one often discussed in open public, but it's actually a fundamental part of our cuisine. If you're consuming rice, yeah, and you're from the Caribbean, and of course, I can hear the Jamaicans now, and you're Jamaican, I know, I get it. The rice and peas, it's the overconsumption of rice and peas which is a challenge, yeah? That's what I say, I'm being Jamaican myself. It's the overconsumption. You see those big plates? Unnecessary. The experts say we should consume no more than a fistful of food per sitting. You see my fist? Yeah? Yeah, a fistful of food per sitting. I know you're from West Africa and I can hear the Ghanaians, I can hear the Nigerians screaming already. Yeah, I'm going to say overconsumption of jollof rice. Yes, I've said it. Yes, I've said it. Yeah, it's the overconsumption. I see these big plates, you know, just like in Jamaica, big plates of rice. It is unnecessary. Our bodies convert the rice to energy. It stores it in our bodies. We know the effect that has on our bodies. And the last examples of starch is where it's hidden in those cakes and those pretty things for parties and unfortunately give to our children. We mistakenly give this to our children in large quantities or allow children, the little child with big bags of sweets. Yeah? Yeah. Bad for us. Bad in the long term, bad in the short term, bad in the medium term, bad in the long term. Now you call a firehead inspired by you're a chef with diabetes, but you don't manage it, but thinking about his cuisine, what he eats each day. And here it is, the direct causal link you see on the screen right now. Examples of bodies. Yeah. You can see the bloated shoulders. You can see the bloated chest. You can see the bloated abdomen, the belly, if you like. You can see the bloated thighs. You can see the bloated bottoms in a light company. Yes, this is the impact, the overconsumption of those items I mentioned. Sugar, salt, yeah, fat, yeah, carbohydrates, and starch all combined to produce bodies like this. And we know bodies like this is not healthy. Yet we know bodies like this usually attributable to low immune response. We know bodies like this is a burden out of our hearts. We know bodies like this is not in your long-term interest, particularly if you're going to birth a child. We know the truth. We know the truth. And I urge you to hear these messages. I urge you to hear these messages. Look at those over bloated bodies. The impact and detrimental impact on our community cannot be understated. Okay? While we must not shame them, we must embrace our members of our community who are in this condition. The experts recommend that we should eat far more fruits and vegetables. You can see on the screen now, you can see the beetroot and the melons. You can see the avocado and the noriega. You can see the grapes, yeah? You can see the pumpkin seed, the apples and the pears. You can see the celery, yeah? You can see the banana. You can see the lemons, yeah? You see the cabbages, yeah? You see the cauliflower, tomatoes. You can see the apples. Oh my gosh, this is beautiful food. This food our bodies can convert into plasma, blood in other words, flesh, and of course promote a good mind, a clear mind. You see the onions, the celery. You can see this beautiful food, yeah? Absolutely beautiful food. This is what our bodies crave for. You see the sweet corn and the cob. Oh my gosh. This is real food, untainted food. This is what our bodies crave, yeah? This is what our bodies crave. Give your bodies what it needs to build you. See the carrots there. This is beautiful food. You see the hazelnuts, yeah? You see the whole nuts, yeah? You see the herbs there. This is what our bodies crave. This is what we recommend, all the experts recommend you should consume each day. This is what will enable you to live a much longer, healthy lifestyle. The experts also recommend that you should drink the appropriate amount of water each day, between 2 to 3 litres, although the foods I've just shown on screen, I've described, all contain water. So just topping up between 2 to 3 litres of water per day is what's recommended by the experts, okay? And of course, make sure it's appropriately hydrated water, in other words, electrolytes in it, yeah? Don't overconsume of water. But we are more than 75% water. So water is life to us. Water is life. The experts recommend if you're eating the right amount of food, appropriate food, you're drinking the appropriate amount of water, and of course, you must, I repeat, you must exercise. Exercise is as important of all what I've just described today. You see the young lady with her weights, and she's pushing up and down on her weight, and I have my weights here. Oh gosh, yeah, I do 200 to 300 push-ups with my weights per day. both arms, both legs, abdomen. I push my body. I can feel the muscles flexing and contracting, flexing and contracting. This is what our bodies crave. And with this, our bodies can build itself. That is what we need to do. That's what you need to do to maintain a healthy lifestyle. You see the gentleman, elderly gentleman, mature gentleman, if you like, with his headphones in, and he's jogging, yeah, with a smile on his face. He can feel his body responding in kind. Oh yeah. You see a young lady running up and down the stairs. That's another form of exercise. I truly recommend and commend running up and down the stairs, because that can be quite exhausting, I can show you. But if you're puffing, you're sweating, it means you're working your body, and that's what our bodies demand. Yep. Otherwise, you're telling your body you want to close down, and that is not good. You see the young man flexing his muscles with his press ups. This is what we need to do every day. And if in doubt, speak to an expert, someone who is trained in those fields. This is what we must do if we want to promote a long, healthy lifestyle. Exercise is life, just like the water, just like those healthy foods I referred to earlier on. Exercise is life. Failure to exercise, despite eating good food, you may as well stop eating the good food, because exercise is an important part of your overall general health and well-being. Of course, I can't just be concerned with your physical self. We've also got to be equally concerned about your mental and spiritual health as well. If in doubt with regards to your mental health, I say to you, please seek out professional advice. If you're concerned about that professional advice, speak to whoever you trust most. I'm going to trust that such a person trusts you and loves you and will give you the support and maybe enable you to go seek out professional advice. I urge you to seek out professional advice. And of course, as regards our spiritual health, naturally, I've got to refer you to your spiritual advisors. Yeah, being able to speak to your spiritual advisors to enable you to have a wholesome spiritual aura around you. I urge you to do so. I urge you to do so. But ultimately, at the end of the day, your general health and well-being is your responsibility. I'm going to say that again. Your general health and well-being is your responsibility. We need to translate these words into action, which is the fundamental reason why these transmissions go out every strong. Yeah? Fundamental reason why they go out every strong. And when I'm heartened by, and many of you will recognize this, what I'm heartened by is the numbers of our members of our communities, whether you be in London or the Southeast, you've been in the Midlands or the North, who've been positively responding to these consistent messages that we must take care of our physical, spiritual, and mental needs. Okay? We can see that increasing numbers of members of our community are coming together in common aim and common purpose. And they're devastating, regardless of their African ethnic background. Yeah? Whether you be Yoruba or Fulani, whether you be Jamaican or African American, whether you be African British, United Pakistan, or any other, we come together in common aim and common purpose. You can be Catholic, you can be Muslim, you can be Christian or other. It doesn't matter. Coming together in common aim and common purpose, pouring your resources, exercise together, is a truly monumental step to go forward. Remember, a family that saves and works together grows together. I say again, a family that saves and works together grows together. So I'm going to show you an example of a group of our members of our community coming together in common aim and common purpose here in South London. I'm so proud of them. And I've seen them in action. People from right across the continent, right across Britain, right across the Americas, coming together in common aim, common purpose, because they understand staying healthy, yeah, eating well, having a positive outlook is an essential part of who we are as human beings. What I want to do now is play a short recording of an example, an actual example This is not my words. This is not my utterances. This is actual action, translating words into action. An example of this in practice. I commend to you the Countdown Organization.
Famous. Hello, 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 hello. Awe, 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 awe. You get one life on leave. Me self get one life on leave. Why we no go use am gladdy gladdy and enjoy the time? Palava no dey finish, time me no dey wait nobody. Now why I dey try for always get am nice every day and night? This one way we all friend we safe, now nobody own. You want to eat with too much, we go down you belly, now you young. And the balance where you go die left, now all the money on. So why for the greedy you say for? Now the motor car where you let buy am, buy am. If you see finance where you call it, bilam, bilam oh. You meet up woman where you let yanam, yanam. And if you let the man na for keep am, want them more. The food where you feel for eat na for eat am, eat am. That fine la pan where you let na for buy am, and tie am oh. And if you baby love you back love am, love am. But if you love them all now you na for left am, want them more. Cause nobody know waiting tomorrow old. So every day of my life till I'm old, I fasting enjoyment stay go. Now for land for care for yourself. Nobody love you past your own self. All man they fed for himself oh. Now why I know they allowed with the other man they can't take me peace away, away. Me joy away, away. Me smile away, away. Oh no no, no make nobody take you peace away, away. Me joy away, away. Me smile away, away. Oh no no, alright. Every day, I see they hustle, they work for the pay. They like na boku on a small you the cage. Land for the loose body 110. No to money, no to gentry. No more they make motor man and brother. As long as you get waiting, you they eat. Land for the loose body 110. This one way we all friend we safe, now nobody own. You want to eat with too much, we go down you belly, now you young. Get the balance where you go die left, now all the money on. So why for the greedy you say for? Now the motor car where you let buy am, buy am. If you see finance where you call it, bilam, bilam oh. You meet up woman where you let yanam, yanam. And if you let the man na for keep am, want them more. The food where you feel for eat na for eat am, eat am. That fine la pan where you let na for buy am, and tie am oh. And if you baby love you back love am, love am. But if you love them all now you na for left am, want them more. Cause nobody know waiting tomorrow old. So every day of my life till I'm old, I fasting enjoyment stay go. Now for land for care for yourself. Nobody love you past your own self. All man they fed for himself oh. Now why I know they allowed with the other man they can't take me peace away, away. Me joy away, away. Me smile away, away. Oh no no, no make nobody take you peace away, away. Me joy away, away. Me smile away, away. Oh no no, alright. Away, away,
Well, huh? Well. Yep, they've come together, a common aim and common purpose. From Africans from right across the continent, here in Europe and the Caribbean. Common aim and common purpose, pool their resources. They've got an expert trainer there in Ishmael, yeah? Expert trainer. You notice the majority were not only, large size, yeah? come together, recognizing sitting there doing nothing is not an option. Yeah? Recognizing, coming together, common aim and common purpose. I recommend, if you're not part of an exercise group, that you join an exercise group. I commend that. I commend the countdown organization to you, of course. But I want you in your own localities to do the same. I want you to do the same. And in doing so, you're giving a positive affirmation to yourself, your loved ones, and those in your wider network. A positive affirmation. A positive affirmation. Now, before I go to the main theme of today's show, I want to give a big shout out to an organization, as many of you will recognize, I admire. Okay, you know, I admire organizations that have a collective role. So I want to give a big shout out to the National Association of Black Supplementary Schools, or NAB. This is where adults and others come together to support our children. Yeah, these are give up their time. They may be trained as teachers, or they may be trained in other professions, but they do this in support of our children. So if you're part of a supplementary school, after school project, or other facilities, yeah, make sure it's registered at the National Association of Black Supplementary Schools website, which of course is www.nabss.org.uk. Or you can email them if you want to find out where is the closest supplementary school or school that is wholly funded by our community. Again, at info@nabss.org.uk. Or of course, you can contact the Inspired Brother Near on 07958 348 558. An important organization, one we should all give support to. And if you can devote some time in support of our children, maybe an hour just once a week, it will be enough. And if 1,000 people did that just once a week, an hour in support of our children, oh yeah, that will be truly transformative. That would be truly transformative. Now I want to get into the main theme of today's show, because it's this is one for some people it will be triggered, and I know by the comments I've had already, some people have been triggered by the subject. And this is, of course, Black maternal health. Okay? Some people have been triggered. I understand why, because they've been through an experience, and it has been traumatizing. Okay? Whether you be a man or a woman, it doesn't matter. You're all equally affected. Okay? It's a time in a human experience, you know, when conception has happened, okay, and a child is on the way. Yeah. That experience will have a profound impact on all of our lives. Certainly for the mother, and most certainly, if I may say so, for the fathers as well. It is equally as traumatizing. Okay, because of course, you know, when you're in a loving relationship, you feel the empathy. You know, so you feel the pain. Trust me, I felt the pain. I felt the pain. Yeah, but I also felt the concern as well to ensure that the child is being well cared for whilst in the womb and immediately after leaving the womb. Okay. Many of you would have listened to the pre-show video, okay, which will happen immediately after the show as well, where I discuss and share with you the stats. And just like, and not dissimilar to, the levels of obesity and health concerns in our community, we also should have concern about the quality of maternal care here in Britain. Okay. I say that and I pause because I know that there are many of you out there who are a bit nervous right now, and I get it. But we're going to be gentle. We're going to be sensitive. But this is a subject we have to discuss. We cannot shine a blind eye. So I'm going to bring my guest in, a most impressive human being, let me assure you. And you're going to find out why momentarily, okay? You're going to understand why, being amongst such people, we can but thrive as a community. Let me bring my guest in. If I can, hopefully this will work. Oh, you never know these technical issues we have every so often. Hopefully this works. Oh, she's smiling at me. Oh, she is smiling. Good morning. Good morning.
Good morning.
Councillor.
Good morning, the motivating.
Oh, you're looking very well. Oh,
Thank
my
you.
gosh. You look so vigorous. Oh, my dear. Ah, there you are. You know, it's this early morning thing, isn't it? You know?
Indeed, I'm excited to be here.
Keep talking. I'm going to adjust your sound. Keep talking to me.
Okay.
How are you? Introduce yourself.
So, hi, audience, everyone listening in. My name is Evelyn Okoto. I'm a councillor in Old Kent Road Ward, and I'm the Cabinet Member for Health and Wellbeing in Southwark.
Beautifully said. Beautifully said. Now then, why have I invited you here this morning? Now, that's the question, huh?
Indeed.
To discuss what is a truly important subject and troubling subject to our community. I know I'm smiling a lot, but I do that sometimes just to cover, I need to sleep so. I don't want it to be too heavy early in the morning. But it's nevertheless a really important subject to discuss, and that's Black maternal health. Okay. And what I want to do, Evelyn, is break down some of the terminology, acronyms, first of all, just to ensure, because you and I kind of live and breathe this sort of stuff, and it's easy for us to fall into, the speak where it's, I call it, in the old days when I was school governor, it was edu speak. Here it's clinical speak,
Oh,
but
gosh.
you and I are not doctors, are we? We're not doctors.
No.
We're not nurses. No, we're not clinically trained. But we are local decision makers.
Indeed.
Yeah. And therefore, it's important for us, most certainly, to understand. And it's so important for us to share information that we learn with the communities. And that's what we're going to do today. We're going to honour our oath to the community.
Indeed.
Let's begin. Black maternal health, and to begin to understand what this actually means. And if you don't mind, Evelyn, what I'm going to do, I'm going to go back to the pre-show video, okay, and I'm going to just run through it, because it provides some structure to my questions. But I know people. I understand that the signal, am I back now? Can you?
You are.
Oh, good. Okay. So, we've got to be gentle, but I need as many of you can to listen keenly to what is being said. Okay, I'm just going to bring the details in now. Just turn on that volume. I'm going to just bring the pre-show video into the screen. Okay. Let's take that, and there you are. So let's begin. Black maternal death scandal, and it is a scandal. I think we can agree that as the outcome. Yeah, at the outset, it is a scandal. Yeah, I think we can say that. And we're not offending the profession. Okay, we're just stating facts. And I thought it was really important that when we discuss this, we discuss it both with men and women. I mentioned a moment ago that I've had a few children myself, and I can assure you, I felt every kick in the mother's belly. And it's difficult to describe. I felt every kick in the mother's belly. Okay. If anything was to happen to either mother or child, I would have been profoundly affected as a man. And I know there are many men out there who feel the same way, and there are many who wouldn't admit it because of some ideas in their head. Okay. So on the screen, I deliberately created this scene. The scene is clear. What the focus of today's show will be. Okay. I want to move on now. Because in starting off with this scene, what I want to do, and I'm going to invite you then to contribute and to elaborate for the purposes of this show to understand how best we can tackle the issue. Okay. So the first question is to understand some of the terminology, as I mentioned a moment ago, because this can be quite, mind-boggling. Okay. So the first term, which is bandied around, and I've seen the professionals use, and I wonder why they use this term: severe maternal morbidity. Wow. I've made it clear what it means, often referred to as near miss or near death. I know those who are sensitive, please bear with us. It's important to understand what these terms mean, why they're being used. Okay. I don't know, even you may have a comment at this point, because you see the figures, they are profound figures.
Indeed.
In 2014, a white woman, compared to black African women, and black African women are 83% more likely, as well as black Caribbean women, I'm not sure why we separate the two, but anyway, to suffer near death, either during or post gestation or birth. What's your immediate reaction to those figures?
Well, obviously, as a Black African woman, this is startling, to say the least. I think what I want to do is start off just to elaborate more about the commission, why I brought this together, and the focus, if I may. So I, 15 years ago, had my first child, and I didn't have a good experience. I think what my one would have been termed as a near miss or near death experience for myself and my child. And so 15 years on, I mean, you never forget that trauma. And you're very right in talking about partners as well. My husband was equally affected, if probably even more so. And I've actually been approached by.
I would just say that, but again, it was even more so affected. I need the men to admit it.
Yes.
There is a tendency for it to come on high. We are even more so affected.
Yes. So yes, men are probably more so affected. And I say this because usually when something happens, everyone rallies around the mother, the support system, the frontline services. You have provisions for the mother to be able to kind of go through the trauma and be healed by it. But a lot of the time, men are forgotten. So I would say sometimes more so than men. So I'm really glad that you're emphasizing men, and it's important they also speak up. And actually, I've been approached by other partners who have told me their experience and said, actually, what I'm doing is allowing them to also speak, which I'm really grateful for. So because of my experience 15 years on, I think my frustration being that the same experience I went through, I mean, I was hearing it again. Women were talking about their experience, near misses as well. The stats were also evident for everyone to see, the fact that Black women are nearly 4 times as likely to die in childbirth than their white counterparts. Asian women twice as likely to die in childbirth. And actually, when we look at it as well, there's a socioeconomic factor with this as well. So women that live in more deprived areas are twice as likely to die from childbirth. So these are startling stats for me that hasn't really shifted.
Okay, can I ask you to pause there? So on the screen, what we're now seeking to do is to project the support, the care that a woman going through pregnancy should receive. And the first area, and I must say, man, this is the first area you're asked to go to the antenatal clinic, for example. Okay. Now, on the screen, I describe it, and it is being described for purposes of those women who've been through it and those who are considering becoming pregnant. Okay, and what care they should anticipate that they should receive. Antenatal care that you receive whilst you are pregnant to make sure your baby and you are as well as possible. The midwife or doctor providing your antenatal care will check the health of you and your baby and give useful information to help you have a healthy pregnancy, including advice about healthy eating and exercise. Did you receive that?
I did. I
You
did
did.
receive antenatal care.
Mm.
And I received, I thought, the necessary information and advice that I needed. So and you have to realize there's difference between those going for the first child who basically is oblivious to what they're entitled to and what they need to
Indeed.
hear, and those who have been through several times. So the antenatal care is is very important. As I say, that sometimes the GP, the doctor, the midwives will get involved in your antenatal care and support you. But this is also important that we need advocates at this point. So for those who, for example, don't speak English as the first language, who struggle to understand literature, they need to have advocates at that point and during antenatal care.
Mhm. And at the point at which a child is coming into the world, you've got this neonatal care, another stream of care, another group of specialists, both doctors and nurses. This is, of course, the first 28 days of life. Over 90,000 babies are born prematurely or sick and in need of neonatal care. Okay, so it's a very specialist area because when treating a newborn, it's nothing like treating a grown adult. And this is why it's a highly specialized area. And I want to ensure mothers understand this is what it's called, neonatal care. And if you're not receiving that neonatal care because your child is sick at the point of birth, you should ask questions. And I suppose this is going to be one of the outcomes of our conversation, asking questions. Continue.
So the neonatal care, obviously, as you say, is for babies who are born prematurely, who cannot go home straight away, and so are sick. So normally the care is in the hospital with the relevant frontline services helping them.
Yes, okay. And it's just really important because, of course, this is an area in which I've had quite a number of queries raised about the quality of neonatal care as an experience, And I'm going to take you out of this because there are so many examples. There's so many examples that I've come across, and I have to question the quality of neonatal care. The other care, if I may, and this come back to you in a moment, on perinatal care, is a period of time when you become pregnant for up to a year after giving birth. Now, you might have heard of the following terms: antenatal, prenatal, meaning before, or postnatal, or postpartum, meaning after birth. So that's the entire scope of care that a woman should expect. Okay, ask questions. Ask questions is so vital here, absolutely vital. And having spoken to a nurse just before coming on the show today, she went through these slides with myself. She felt that these slides were appropriate slides because they highlighted the type of care that a woman can expect. Okay, and of course, this is the issue, and for our debate today evening, if I may come to that in a moment. Okay, now then, you continue because now we get into the issues to why we're here today. Go ahead.
Yeah, so I think one of the perinatal is normally also termed as perinatal mental health support as well.
Indeed.
So
Yes.
that is women who are suffering mental health issues, and they will be supported sometimes before, if they are planning a pregnancy, so the before, during, and after. And there's a range of services and supporting those individuals.
Mm-hmm.
So at this point, you talk about the systematic racism within UK maternity care. As I've said, this is a commission which is going to be spanned over 6-7 months. The last meeting will be in September. And so what I don't want to do is preempt the end and preempt what I'm hearing. But from all literature, lots of people talk about racism felt within this environment. Because so what some women say, how then do you explain that Black women are 4 times likely to die?
Okay, if I may at that point, because so now you're taking this anecdotal evidence, so we now have experts investigating. Okay, now let's take this article here. Systematic racism within the UK maternity care is risking the safety of people from Black, Asian, and mixed ethnic backgrounds, often with devastating consequences, according to a report by the child charity Birth Rights. And this was reported in the Guardian newspaper on the 23rd of May 2022. I put that references on, and I want those who are listening, those who are viewing, to do their own research. take responsibility for the information that I'm sharing and to either reinforce or question some of the information. I've had called to question, but I've made sure whatever is on screen has been validated. Okay? So this is not some idle discussion. This is not some idle discussion. This is not a feeling that you're responding to because you're the councillor, you're a cabinet member for health and well-being. You've got personal and you can see anecdotal evidence in and around the community. That's what we're responding to. Continue.
Definitely. We're responding to what women have spoken about, their experience. And the biggest one is not being heard, not being listened to, expressing an anguish or frustration or concern and not being taken seriously. This I've heard over and over again. And women takes it that it boils down actually to racism or to kind of a preconceived ideas about women. I mean, I think a decade ago there was this kind of thing that was going through the health system that Black women could tolerate pain more than others, just utterly ridiculous. And so, that could be a factor. We're looking through it, and obviously, you've highlighted a really reputable article about this. So there has been written evidence that actually racism has been one of the key elements in this disparity that we face, and it's important.
So we've just had the recent. Again, I think it was Channel 4 or the Dispatches program in relation to the post office postmasters illegal sentencing and manipulation of their software. It took a TV program to highlight it.
Yeah.
Okay? Here's another TV program, the Channel 4 Dispatches. Now, the presenter, Rochelle Humes, demanded action over the shocking disparity of maternal death between white and non-white women. According to the latest figures discussed in the Channel 4 Dispatches program, Black women are just over 4 times more likely to die during pregnancy and childbirth and up to 6 weeks postpartum, in other words, after birth. And she demanded action because the figures were so stark. And this was aired on Monday, the 29th of March, 2021. It's there in the public domain. This is detailed journalistic research and investigation into the issue. And this presenter was overwhelmed by the evidence. Again, this is not you and I discussing anecdotal evidence. It has been objectively looked into and determined that there is more than simply professional incompetence, which is how it might be described by others. But there are other underlying reasons why this disparity exists. It is not just because women are not healthy. There are other factors brought to play. Okay, but what do you think about yet another TV show? I mean, necessary.
And I'm glad you mentioned yet another TV show. Martin, this stats that we're talking about, this issue that we're talking about, has been around for decades. Not just in this country, across the pond as well, across our European neighbors as well. This is an issue that is ingrained, is systematic, is being discussed over and over again. And I'm glad we got to the point whereby actually there is now a renewed focus that something really needs to be changed right now, and there's more voices to it. So the film you talked about, yes, it was great, again, for someone else to highlight, someone high profile to highlight. But let's not get this wrong. This is not new. We've been dealing with this for a while, and there's time. It's time that this actually drastically change, and that is not just by lip service. That is not just by recommendations that no one is following. It is by systematic root and branch changes that we need to make sure, actually, that the figures we keep quoting over and over again is lowered once and for all.
Yeah, and at this point, and again, so you and I, as local politicians, okay, are always dependent upon central government. So it's really good to see that in Parliament, there's an all-party parliamentary group on Black maternal health. Now, the APG aims to raise awareness of the issues of racial disparities within the maternal care and offer solutions to this end. I'm really proud that it's quite dominated by quite a number of MPs from our community, and indeed quite a few South London MPs, I note. I'm pleased that the chair is MP Bell Rebel Addy, for example. the vice chair is indeed a Conservative MP, Caroline Noakes. Okay, again, vice chair, someone I know quite well, Florence. As you know her very well. Yeah? She's also vice chair. Another vice chair, Kirsten Oswald from SNP. Another vice chair, another South London a black woman MP, Marsha D. Cover. Another South London MP, another MP, of course, Kim Johnson, and of course, the renowned Dawn Butler is also a member of the committee, as are others. Our very own Helen Hayes here in the Southwark area is also a member of the all-party parliamentary group on black maternal health. Well done, Helen. Well done.
Indeed.
Over to you.
So yes, I mean, I am so heartened about this group, and they are also being supported by 5 times more campaign group as well. So a really powerful group of women and individuals. So I attended the last APPG meeting to talk about the Southwark Commission and where we are, and just the kind of key findings that we're having right now. And it was, it was striking. The women there, they were really impassionate, everyone doing their part. And we touched upon FGM and the support for women going through that system. We're talking about that kind of before support, before you get pregnant and after you get pregnant support. There were various VCSs there who support women if they have lost a child, etc. So there were a group and a wealth of, I would say, goodwill and people ready to tackle this subject. There was, I think I commend the APPG.
My only comment, of course, because the work is important, there are no men on it's curious omission. I find that curious omission myself, but not a criticism. I just find it a curious omission. Okay, but anyway, there you are.
I will say we are very clear that we want to hear the voices of men. We want to hear the voices of loved ones. So there is an opportunity for anyone who wants to add their voice to this commission to do so.
All right. Let's talk about the commission that you chair. You founded here in Southwark. Okay, and I was so proud to come along to your first meeting to observe. It was really proud. Just tell us who are the constituent members of the commission and what their roles might be. Go ahead.
Okay, so the commission members, I'm just going to read off. I've got a list here, if you don't mind. I want to talk more about them. So I'm co-chair. So my other co-chair is Dame Donna Kinner, and she's a former president of the Royal College of Nursing, has an extinguished history behind her, has been involved in areas of maternal kind of reports and research as well. So she's really esteemed as someone who's very dedicated to this role. We have Dr. Benedicta Osuji, who is a director of midwifery and gynecology nursing, also in Epsom University Hospital. Again, very dedicated and passionate about this subject. We have Omar Campbell and Michelle Misgalia, and they are from the King's College Hospital Maternity Voices Partnership. So this is a partnership of frontline services, so doctors, midwives, and patients, and those who recently have had a child, all coming together to make sure that that kind of maternal experience is good. We have Sandra Igwe. She is the chief executive of the Motherhood Group, another, firebrand who is really pushing out the need to change things in this sphere. We have Cheryl Rode, who's the director of Home Start Southwark, and they provide support for families, for women, and advocacy as well. And then we have Jackie Kempen, and she is the head of maternity from the South East London Integrated Care System. So really powerful women on the.
Wow. No men.
No men. And it wasn't deliberate. It wasn't deliberate.
Not a criticism. I'm only observing. You see, you need a few young men there, because they're the ones, who are.
Well, we are getting the male voices through the doctors, through the nurses, through the practitioners, frontline services. They're also adding their voice. And again, obviously, those who have gone through any experiences as well.
I keep emphasizing that women are never alone. I want to keep emphasizing it is as much a concern to men as it is to women. We definitely do not want you to have poor maternal care. We want you to have the best possible care. Yeah, and we equally will be offended if you do not have those positive experience in what is the most vulnerable, amongst the most vulnerable times in our lives. I did keep emphasizing this because I know the women are strong and all that, but oh my dear, come on, let's do this. So set out now the purpose of the commission. Now you've been alluding to it, that it's there on the screen. Just expand upon each of our bullet points, just so we're clear.
So the first bullet point, and just to say, as the overall arching theme is to listen and review the access, experience, and outcome of women going through the maternity process. But there is an element that we will be focusing on Black women and their experience, mainly because they are disproportionately impacted by the stats that we talk about.
We've
So
seen
the
evidence. Yeah.
Yes. So the first bullet point is hold meetings, listen, and exercise. Important for us to listen. I mean, I can read a whole load of documents and then make up my mind, then so could you. But it's important, especially the fact that I'm focusing on just Southwark right now. It's important that we listen to Southwark families, Southwark women, and Southwark frontline professionals to hear their experience as well. Raising community awareness about having a safe pregnancy and birth. I mean, there's so much into this. My hope is that through this commission and at the end, we'll be able to put together some kind of documentation to help women, understand the importance and what is important during the process. And I think the first meeting, what we actually took out from there is that we always concentrate on the pregnancy stage, but not the before and after.
Indeed.
And the before is so important to make sure that women are in great health. And if they're not, what are we doing to support them through the process? So again, that
coming up to that point there, forgive me for dropping, but in terms of the before, I know you're not a health professional. Don't worry, I get that. Don't worry. But what do you mean before? What is it generally that the women in preparing for pregnancy? What is it they need to do?
Well, first of all, every woman that planning pregnancy is about being in the best health. It's about taking, the folic acid before and during your pregnancy for a certain time. So all of this knowledge is really important. But it's an issue of morbidity that adds complication to pregnancy. So morbidity could be obesity, it could be high blood pressure, it could be cardiovascular disease, etc. So any woman who have these underlying health conditions, their pregnancy would be a bit more risky and they need more support going through it. So it is important that those health professionals, the GPs especially, who are the first point of call really to a lot of us, identify women who need that extra support and extra help. And there's something called a continuity of carer pathway that, those individuals should be put on that continuity carer pathway. So basically they will have the same midwives, the same health professionals to see them through so that there is no gap in their care, because obviously they are higher risk. So knowing this is really important.
Thank you. And of course, you may have seen the earlier part of this transmission where I focus on lifestyle messages. And I point out the levels of diabetes. This is your portfolio, of course. Levels of diabetes, levels of hypertension, high blood pressure in the community, levels of obesity in the community, levels of the respiratory conditions in the community, cancers in the community, which is directly attributed to lifestyle. So there's something quite fundamental about our lifestyle and our cuisines that may be a contributing factor. This is not to give the professionals a leg out, mind you, but may be a contributing factor to levels of morbidity. I'm going to be careful about using those words. In other words, complications during and indeed after gestation or after birth. Yeah? So I've already put that on the table for those women and others who are listening and viewing what we're saying here, that we must all together do better in terms of how lifestyle and how we take care of ourselves, indeed what we eat each day. Okay. So let's talk about post-birth, post-gestation. What is the general advice there?
Well, we also know that death also occur post gestation, so after birth, up to a year. That's really the kind of 28 days a year really risky time for women when we talk about mortality. So after birth, it's important that after birth care, the postnatal care is very key, and obviously you should be visited by a midwife, very very quickly after you give birth when you go home. And then before they hand you over to the next professional. And it's at that time really that any concerns women have, whether with the baby, whether it's themselves, that they have to voice it out. They have to seek that medical attention. They have to seek that help, and they have to speak out. And one thing we also find is that post birth is also where perinatal mental health increases. The kind of mental health issues creeps up. The depression, the loneliness really comes to the fore. And so any woman feeling any of these kind of symptoms has to get help. And so that postnatal support is also very, very crucial.
And I gather, Evelyn, that the majority of the deaths is occurring at the neonatal and the perinatal, in other words, post-gestation stage. That's where the majority of deaths, both to either babies or mothers, occurs. I found that particularly disturbing. I have to tell you, I found it particularly disturbing. When I recall my first, and the little thing was so small and vulnerable, the very idea that you would have lost that through reasons that you don't fully understand, I find truly shocking. And I know, as I said in the prelim to this show, I've had both men and women speak to me on the subject and question if I should do this, because it might create some distress. And we need to, at the end of this, give out some details where people can obtain advice if they're feeling that the information we've shared today, as make them feel unsettled. We might have a number or a reference or two that they can go to. But I understand those feelings. I feel it even now. I'm thinking it through. The very idea that one would lose a child either just before gestation, during the neonatal stage, or indeed up to a year after. That's where the majority of the deaths are occurring.
Can I just interject there? I think what people don't understand, I mean, we always, we talk about the beauty of giving birth, and then, everything is going to be hunky-dory. The mother's happy, everyone's happy, let's move on. Actually, that is the most, I wouldn't say dangerous, that was the most vulnerable time of a woman's life, when she's give birth. As soon as she gives birth and she's at home with the child, especially if it's your first child, you don't understand your feelings. You don't understand what you're meant to be feeling towards that child. You're not able to cope. You're not able to sleep. That is a very, very vulnerable stage of a woman's life. And we need to address this. And so that midwife visit, it's crucial that happens, and it's crucial that it happens straight away, as early as possible. And it's crucial that women are also able to voice out, actually, something has happened to me, and it's important that the women are listened, because there have been instances, what I've heard, that women have expressed, kind of mental health questions that they're feeling, and they haven't been supported quickly enough, and it just things have spiraled. So that area is also one that we really need to look at.
And why, of course, fathers are equally important. That support for woman and child is so important. Fathers are critical here at this point. And I say to dads, and I say to granddads even, rally round.
I think it's the wider family. I mean, for me, when I went through my trauma, it was my mother that had to deal with a lot of the feelings of being with her daughter, seeing what she's going for and not able to help. My husband was equally traumatized. He doesn't know what to do to help. So when we talk about men, yes, again, men will be concentrating on the partners, the mother, to make sure she's well, to make sure she's coping well. And sometimes they forget about their needs and what they're feeling. And they can crash very, very quickly as well, And you hear so many horror stories about men just not coping with the child, not bonding with the child, because they haven't dealt with their trauma as well. So very much men need to be a part of this conversation.
Thank you. Then you go on at the end here by provide a message of solidarity. In this case, we're here in South London, in Southwark, to the people of Southwark. What do you mean by that? What do you mean by that statement?
Before I go there, so there's one bullet points before that. There's bring about change in maternity care
Oh, forgive me. Yes,
to
indeed.
help
Forgive
reduce
me. Yes.
maternity inequalities. The whole aim of this commission is to look at the gaps, is to highlight the gaps, and is to make sure something is, put in place to support women going forward. So it's not just about listening; it's about doing it as well. I'm a kind of person, I don't like talking that much. It's about what's the action afterwards. So for me, it is about what is the recommendation afterwards, what is the action afterwards, and who we can work with to make sure that we close the gaps that we have identified. So the last point is about.
Before we go to the last point, and forgive me, I'm not sure why I missed out that most important bullet point you just elucidated. Just to understand this, of course, you are we're in Southwark in London. Okay, you are a cabinet member for health and well-being, and within your portfolio, social care is your portfolio. Yep. Okay. Social care
Public health.
and chair indeed, and public health indeed. But you're not NHS.
No.
Right. Okay. In order for this commission to work and to be effective, it's a partnership between yourself and the NHS. Okay. Are your NHS colleagues up for this?
I sincerely hope so. Well, I have to be diplomatic. I sincerely hope so. I mean, currently, I'm the chair of the Integrated Care Partnership in Southwark. Also, will be the chair of the health.
I'm really sorry. I know what you mean, but I realize you've got to explain.
Okay. So the integrated. So I'm not sure. Some of you would have heard. So it's the health partnership. So the integrated. Yeah. So the Integrated Care Partnership is the health body. It used to be called the CCG. Is now the Integrated Care Partnership. And the Integrated Care Partnership, the move towards the integration is to bring more partners around the table with health to be able to solve and close the inequalities gap.
So this is about primary and secondary care. In other words, hospital settings and, of course, out in the community, primary.
Yes.
So those professionals,
Yes. So I'm co-chair. The other co-chair is Nancy Kutcherman, and she's a GP in Southwark. And around the table, the members, we have the two big trusts, so the Guy's St. Thomas's. We have SLAM as well for mental health. We have VCSs, and
VCS.
Sorry, voluntary community groups as well. And then we have the council. So the key partners within the borough that will help to improve health of our community and close that inequalities gap.
Mm-hmm.
So
now, clearly, the NHS, of course, whenever we talk about and discuss the pregnancy and doctors, we're actually discussing the NHS because social care is not directly involved. Am I right?
No.
Right. Okay. So I'm interested if there's, and I know you're going through the process right now in the commission, and I hear you, and I know you've got to be careful with what you say. Is there a difference in those in primary care, in other words, GPs, nurses out there in the community, and those in secondary care, that's in the hospital setting where you see the consultants and the highly specialised expensive units? Is there a difference in their enthusiasm for the commission and its intent?
Well, that's a really good question because we've heard from those in hospitals, so the guys in St. Thomas's and SLAM, and the next meeting we're going to hear from the GPs.
All right, primary care.
Yeah, the primary care. But I will say that primary care from the GP that I spoke to, she mentioned actually that GP should be at the forefront of this. They should be involved. We should be mentioning GPs because people are with GPs majority of their lives as opposed to secondary care, which is the hospitals. And so for me that was really heartened because now they seem that we should be part of this and we want to get involved to help solve the problem. So we'll hear from the GPs at the next meeting and hopefully they will be as enthusiastic as I hope.
Well, let's hope so, and I agree with you. Let's hope that they are up for this. As you say, this is a situation that has existed for more than a year, for more than a decade, 10 years. It has existed for some time. Okay, I came to public life, as you know, as a result of becoming a school governor for my children's school. I was concerned at the time at the poor quality education that in our borough 30 years ago existed. Okay, but we've been a part of that change that's occurred now in the education sector. Tremendous strides, tremendous change. So now we're in the upper quartile in terms of general performance of local authorities across the country. Can we achieve the same result here in the health, where we've got primary and secondary care, in other words, community-based care and hospital-based care, and the council with social care. And you might want to explain what social care means in a moment. And of course, and then you have a council broader objective to have a borough that is powered by the people. In other words, people's opinions guide and shape decision making at the local level. So before I go into the other question, just describe what we mean by social care. Because as I said, you and I know this, and I've learned during these broadcasts that I've got to ensure that we break down each of these words so it's clearly understood by the masses, not by the few. Yeah, social care, because that's your specific portfolio responsibility. Yeah.
Okay, so my specific portfolio of responsibility is public health and social care. So social care deals with providing support to people, our most vulnerable group of people. So those who are older people, those with disabilities, learning disabilities, and mental health. So that's what social care is. So obviously, is a bit aside to what we're focusing about on maternity commission. However, the element of physical disability and learning disability is important, because there is an angle whereby how we look at how women in this group are supported.
Yes.
Women who have learning disabilities, how are they supported? What kind of support that they have? Those with physical disabilities, what kind of support that they have? So these particular groups, because obviously we're talking about childbearing age, of all spectrum, of all disabilities, of all abilities, as I said. So how are they also specifically being supported? And at the first meeting, one of the speakers talked about a particular support for those with learning disabilities and physical disabilities. So we are following up to see what more is there and how we can increase our support.
And I suppose I've just got a message. What do we mean by public health? Isn't all health public? Question.
So public health came into the local authority about a decade or so ago, I believe 2013. And we deal with just how to improve the population health. So it's about information, it's about sexual health, it's about making sure that we have adequate services for our communities, about closing the inequalities gap. It's about the general increasing the knowledge and the health of the general population in the borough.
Perfect. Which is why, of course, you chair the commission.
Yes.
Perfect. Absolutely right. Absolutely right. So let's kind of put some context and some little detail. And those of you who are listening and viewing, there's a recording, of course, on YouTube. So we can go over each of these terms again, just to make sure you've made appropriate notes. Let's now, of course, you and I are politicians, of course. We're politicians, local politicians. And I see here, provide a message of solidarity to the people of Southwark. What is the message you want to get across, that message of solidarity?
That we hear you.
Oh.
That we are listening.
Yes.
That we want to support you. We want to work with you through this. That we want to improve the services for you. It's a message to say that, we're doing this for our residents. We're doing this for them. We want to hear them. We want to know what to do to improve this area of service for them. So that is the solidarity message to the people of Southwark, that we are listening.
That's very succinct, isn't it? And direct and absolutely true. A borough powered by the people. Oh yeah. You've now beautifully outlined the commission and its intent. Okay. I now need to talk about the various parts to the various stages. Okay. So you've held the first meeting. Can I just ask you just take us through the stages that you will go through in order to get to a point at which you will produce a report? Okay. Just take us through. So this first will describe the first meeting which I attended recently. What was its purpose? Then go on to the second meeting that's scheduled in March.
Okay, I'm trying to also get dates as well. So So the first meeting was the introduction to the Maternity Commission, and it was presentation of neonatal and local data on maternity care. We're listening to Guy St. Thomas's Trust, the big trust within the borough. We asked them a few questions about how they're providing services to women. You know, what is the rate? So just wanted to glean some information for them, and we heard them. So that was really the introduction meeting to the maternity, talking to our big trust. The second meeting is going to be on 14th of March. And that is, we're listening to local frontline voices. So we're talking about the frontline maternity care professionals, those that are working to reduce the health inequalities gap in maternity care, the GPs. What are they seeing? What are they hearing? What is their concern? How can this commission support them in the work they do? What is basically hindering them to do the best work that they can do? So that is going to be in meeting 2. Meeting 3, which will be on the 17th of April, is listening to people who use the Southern Maternity Care Service. So this is going to be really, I think, emotional and emotive meetings. We are going to hear from service users and their experience. So what we've said that we want to listen or hear from at least 1,000 women from different areas from our survey. From
1,000 women, right?
Yeah.
1,000 women and men, or just women? I'm
1,000
only
women,
asking.
1,000
Keep
women
asking the
and
question.
men. 1,000 women and men. 1,000 women and men. Anyone that want to get involved, we want to listen to them. And so that is via a survey that we're doing, is via one-to-one sessions. People will prefer that. It's via group sessions if people would prefer that, and it's by anonymous email if you want to do that, or voicemail. We've got all the details on the website if you want to get involved. So the third meeting will be about listening to Southern maternity, those women and loved ones who have experienced the maternity care in the last 5 years, and anyone really that wants to add their voice to it. The fourth meeting is going to be focused on listening to Black women. And this is specific mainly because, again, Black women are disproportionately impacted.
Yes.
And so it's really important, if we're talking about closing the health inequalities gap or the maternal inequalities gap, it's important that those who are further away from being supported are listened to. So that fourth meeting, which is going to be on the 22nd of May, is going to be, I wouldn't say a closed meeting, but we would like people to book and let us know they're coming. It's going to be predominantly for Black women who have been pregnant or are pregnant or have gone through the system the last 5 years, or actually just want to attend, listen, or add their voice. Right. The last meeting is the fifth meeting. It's the fifth meeting is not the last one. It's 24th of July. We're going to be looking at recommendations based upon what we've heard so far. So upcoming and emerging recommendations. And the last meeting will be on the 25th of September. And that will be the kind of organizational commitment to maternity care changes. So what we've recommended, we want to get commitment from the trust and from the local partnership that they will implement it and work with us to do so.
And do you think the trust will sign up to this?
I believe they will. I mean, we need to work with them. I think the most important thing is that we need to come up with practical solutions. There's no point talking about, okay, I want you to commit to no deaths next year. We know that's going to be impossible. It's going to take time for things to bed in. So what is it? What is a reasonable length of time? What is it that we want to put in place? I talked about continuity of care, which is really important to support women, especially those who may have complicated pregnancies. What is the percentage? Right now, actually, guys and kins, their percentage of women who are going to the continuity of care is below the national average.
Oh.
So we need to address that. So it's about practical solutions that will help women of Southwark.
All right. In that case, and that's, if I may, I just want to take this one stage further to describe the various parts to the commission and the date which it will meet. It will meet presumably. Maybe what I should do is bring up the your website, the commission's website, and you just tell me, and I'll just go for the details, make sure we've got this right. You take us out to the street for a moment, and there you are in your glorious light. And now let me bring the other side in for you. But it's going to be really important. You said there's a target of 1,000 respondents, okay, men and women. 1,000 respondents, which seems to be quite a large figure, very ambitious figure. No?
Very.
Am I right to say that? Okay. So that's interesting. So it's information. How do people get to know about this? So yes, this is one route. They will watch this video. There's no doubt about that. But how you ensure that residents get to know about the commission and its intent?
Okay, so we're using all channels at our disposal. So obviously, this is one. We've got the Southwark Maternity Commission online, which has all the information. It has a survey. It has various ways of how you can connect to the commission, add your voice to it as well. We are also connected to all our family centres within the borough. All our frontline services have that information to be able to speak to women. We are going to make sure our kins and guys have this information so they can also pass this information, this document and our quest on to women they encounter. We have Southwark Life, which goes out to all Southwark homes.
A local magazine.
Exactly, a magazine. We're going to put that information there with the full detail. We have the voluntary community groups. We are going to make sure that they can disseminate that information. So every avenue that we normally use as a local authority to connect with our residents, we're going to use to make sure that more people hear about this and adding a voice to it.
And you be using these sort of faith communities as a conduit as well?
Yes.
Mosques and so
definitely.
As an excellent conduit. In fact, I was with one in Campbell Green, the converted cinema there. I met their community outreach person. I mentioned I'll be doing this interview today, so I'm assuring you she'll be in touch with you on Monday morning. I gather.
Right.
So as part of this, I believe you mentioned that there is a survey, and in fact I've just found it. So in order to find this website, this is the Southwark Council's website, which focuses on the Southwark Maternity Commission, I recommend you put in your search engine Southwark Maternity Commission, and that should take you directly to this website. You can see the commission members, and you can see a very heavily pregnant commission. Who's that is heavily pregnant? I remember her when I met her. I was nervous as a man, I have to tell you. Who is that?
So that is Sandra. She is the CEO of the Motherhood Group.
Wow, courageous. I thought she was great. And she sat there for nearly 2 hours as well. Oh my gosh, very, very good.
And she's also had her experience as well.
Oh, yes.
With her was more perinatal support that she needed when she gave birth. And also the fact that, the kind of experiences she had with a pregnancy. So she also has lived experience, which is very invaluable, yes.
Such a powerful testimony. And now you want residents to complete the survey, which is at the top of the screen. Let me, if I open it up for them, I open up the survey, and there is a survey. So just tell us about this survey, what it's supposed to solicit from residents.
Well, the survey wants to hear people's experiences. So he asks various questions about your experiences and anything particular. I mean, what we want to glean is to identify if there's a commonality or a common thread through people's kind of bad experiences going through the maternity process. What is it that people keep talking about? What we've heard so far in some of our meetings is about language as well. So it is about gleaning what the commonality is. It's about gleaning what actually things that stick out. Okay, gosh, a lot of people are talking about this area. We need to do something about it. So it is that trying to find out people's experience, people's thoughts, people's contributions, their expertise as well.
All right, thank you for that. Now then, I see here that on the website there's a telephone number and email address. Just so I'm clear, then, do you want residents to attend the actual commission meetings? Do you want them to complete the online survey? Do you want them to listen? I see that the details appear on screen. What's your preference in terms of contact?
If you can do all of the above, that would be brilliant. I would like more people to attend the meeting because it's important that if we are all really passionate about this, that you show your support by being present at the meetings. So the professionals need to see that there is an appetite for us getting this well and doing this better. And it will only be felt if people are present at the meeting. Obviously, the survey is very important as well for those who may not be able to attend the meetings or who want to be able to give the information in a different way and not they want to come to the meeting, but they don't want to speak. The survey is there to be able to glean that information. The email is there as well. You can email us anonymously. We take GDPR very important, very, very seriously. So if you don't want to tell us who you are, you just want to give the information, that is also very, perfectly fine. So we want to give as many avenues to people to be able to utilize and add their voice to this.
I hope that happens. And I note, of course, that if they're to attend the meeting, I see here, note on the website that it's at the Rye Oak Children and Family Centre in Wharton Road in, I believe, Peckham, SE15
Yes.
EPD. So I'll
Yes.
just say that again. So it's at the, it's from 5:30 to 8:30 p.m. on Thursday, the 14th of March, at the Rye Oak Children's and Family Centre at Wharton's Road, at WHORLTON Road, and that's in Peckham. It's S for sugar, E15 3PD for Donald.
Yes.
So that's the location on the 14th of March for those who are able to attend. Okay, there you are. Then on the 17th of April, Wednesday the 17th of April, it's at the same location, but from 10 a.m. to 12:30 a.m. So that's quite early in the day, of course. But I'm sure there's good reason why it's that early in the day.
And can I just say, I mean, we picked this times and the venue because we are going to provide creche as well. So if you want to come and bring your children, there will be creche provision for you. So look after your children, so you'll be able to sit in and listen and contribute as well. So please don't let this be a hindrance. If you want to come, please do let us know, and we will make sure we provide creche facilities.
Right. And I note that you're asking residents to book their space. In other words, it's finite. How many seats? Do you know how many seats you have?
I think the Rye Oak, I'm not too sure. Probably about 30, 40. I'm kind of guessing because I've
Okay.
well,
That's okay. That's all right. Just so that we know, we want to get a few hundred there, he says, but
100%. As many as possible. If we need to get a bigger venue, we can. So we just need to get as many people as possible.
But the subject matter is incredibly important. It's incredibly important, and I so welcome your work in this area. I'll take this off the screen now, and I will distribute those dates in the forthcoming weeks and months as we proceed. And we might get you back midway through, just give us an update on what is happening. But let's take the screen off for the moment, and let's put you back on in your bright and gleaming. So we've now understood the subject. We've got much better understanding of the subject of black maternal care. We understand the context, that there's a lot of objective evidence, and indeed we have personal evidence, anecdotal evidence, of the quality of care is a cause for concern. We're working, he says, with the NHS, both primary care, which is community-based services, and specialist secondary care, which is hospital-based services, okay, to come together to examine ways in which we can improve that experience of black women, or non-white women. Okay, because this does include Asian women, I note in the analysis. I think that's which is also be said. So that's understood as well. The meetings are now on the council's website, and I recommend that the audience, if in doubt, just use the search engine and put in Southwark Maternity Commission. Okay, so it's clear. It's an easy search. I just did it, and you can see the information I was able to display. I've got that. And the impetus behind this, Councillor Evelyn Koto, because you've got first-hand experience, and within your immediate family and networks, there are many experiences which mirror your own, and I've come across them myself. So we need to work together. I'm just conscious of time now, so if there's a message you want to communicate to the audience that should be a ringing tone following this interview, what would be your key message for them?
This is the time for us to change this.
Oh, what's that? Absolutely. It is time for change.
I can't say any further than that. We have to all together, with one voice, with one accord, push for a change, because this is getting out of hand. We can't come back 5 years time the line. You can't be having another meeting. We can't be having other reports saying that more Black women, more Asian women, because of their ethnicity and their socioeconomic status, are dying. This time for change.
I'm bound to ask you, because we've not strayed into politics, even though we are two politicians. Okay. I've read recently that the government has declined to invest in maternal care, okay, despite all the criticisms that have been levelled at the government by the profession. Why would the government do such a thing when the figures are stark and are unnerving? What's going on here? You're the politician on the front line in this regard.
Well, I mean, there's so much I can say to this, but I think let me keep it short. I mean, first of all, we know that the NHS has been depleted of all its resources. It's literally is on its knees. We know that we need thousands more midwives and health visitors to be able to support the number of women who are going through the birthing process. Mm-hmm. We know that actually local authorities who can help with, because we commission some of these services, yes, our funding is also being cut. Yes. And so there has to be they have to be intentional. And I don't think that the government see this as a big problem, because it's not just Black women who have been hard done by for so many decades. It's actually all women. And I keep saying, yes, if you don't get it right for women, the most vulnerable, and Black women, the most vulnerable groups, actually, we don't get it right for anyone. Mm-hmm. So for me, it is that because there's no focus, the money hasn't been directed to it. And so why we're still having this discussion.
Wow. Well said, well said. And of course, it's important, again, we are politicians, and I'm bound to say this, of course. It is likely that we will have a general election within the next 12 months. Okay. Is there any indication from the opposition benches, okay, indeed from our own party, what our own party might do in respect of maternity care?
Definitely. And I think all the APPG work that is going on is testament to the fact that they're very serious about this. I know, and I've spoken to some of the shadow cabinet about what work we're doing. And everyone's very interested to see the outcome, because again, this will formulate policies and this formulate plans. This is very much for the whole of the shadow government, very much one of their main focus, because they want to tackle inequalities, and maternal inequalities is one that in the figures is so stark that people can't get away from. So definitely is going to be a focus, hopefully in the next government.
Yes, it is so true. And my last question is on the commission, and I've looked across London. I'm finding great difficulty finding a comparable body to the innovative commission that you've set up here in Southwark, here in London. Am I right in my observation that there are no comparator in London or in other places?
None. I've checked as well, and I think we're the first local authority to be looking specifically at maternal inequalities and looking at the kind of disparities, especially within our ethnicity as well. So our focus is very clear, and I think we're the only one so far that is doing. And I think it's important that other local authorities also look at what we're doing and take heed and run with their own commission, because the more voices around this, the better chance we have of changing the tide.
So in other words, the London Borough of Southwark is leading the way.
It's leading the way, as always.
In a good way, of course. In a good way. And this is not in any way to boost the Southwark, we would like to do so, but it's such an important, serious issue. If we can encourage other boroughs in London, indeed other cities across the country, even other county authorities to do the same, together we all would make a difference.
Indeed. And can I just say that Southwark is one of the most diverse boroughs.
It is.
40% of our residents actually were born outside of the UK. Our largest kind of ethnic groups are Nigeria, Ghana, the Jamaica. Yes. So if we don't get it right for boroughs like Southwark, and if we don't have focus, actually is a missed opportunity, and I think every other borough will struggle as well. So I think it's important for us to lead the way and for others to look at what we're doing and help us and follow suit themselves.
Beautifully said. Councillor Evelyn Bakoto, Cabinet Member for Health and Wellbeing, Chair of the Southwark Maternity Commission. I want to thank you for being an outstanding guest today. Outstanding guest. You are engaged in such important work. We all want you and the Commission to succeed.
Thank you.
Thank you so much. I wish you well, and we will keep talking, and we'll have you back again midway through.
Indeed.
But we want you to succeed. There are many people out there who are concerned that, as you said, this is an issue that we haven't yet taken the leadership on. But Southwark, with your brilliant leadership, has taken the lead on this subject and is forging links with the NHS. And not blaming the NHS, working with the NHS.
Indeed.
So together we improve the experience for all, both those who work in the profession and those who experience the profession.
Indeed.
Wonderful.
Thank you so much.
Thank you so much. Good day to you.
You too.
Wow. And be close to your family. Enjoy your family today. Don't do any work. Just enjoy your family today. Yeah.
Thank you so much.
You've got wonderful children. All right. Take care. Bye bye. Wow. There you are, people. There you are. Wasn't that fantastic? It is further evidence that it's so important for us not to stay along the sidelines and look. We've got to be active participants in change, active participants to effect change. Yeah? It doesn't happen to us, it happens with us. That's why I do these podcasts. That's why it's so important to get these messages out so we are impactful. And there you are, a mother, yeah, a counsellor, able to use her position to engage one of the most important parts of government, that is the NHS. So it provides the qualities of services that we all can expect. Yeah, we can all expect. And I see the messages on the side here, and I thank you for those messages. But I equally encourage you who've listened, who are viewing this message, to get involved. Even if you don't live in Southwark, just come down to the meetings and observe. And if it's not happening in your borough, in your city, in your county authority, encourage the local politicians to do the same. Yeah? Set up their own maternity commission. Because the figures here in Southwark or in London are replicated throughout the country. The change will only happen when you desire that change to happen. Because you get involved and you're part of that change process. I commend the Southwark Maternity Commission to you, and we'll keep monitoring its progress because it's fundamental work. It's fundamental work that must, forgive me, will succeed. Well done, well done, well done, well done. Oh, I'm feeling so high now. I feel so high. And we know in the same company, people like Councillor Evelyn Bakoto. You know we've got hope for humanity. There's hope for humanity. Yeah. And all in us engaging extraordinary work. And we're all in that position. It's a mindset. Which is why I always say the whole purpose of these shows is to translate words into action, because success is ours for the taking. Brilliant. So what I'm going to do is give a few, before we go, a few announcements of those persons in the community who engage in positive works. Okay? I know some of you argue, well, why do you need positive work? Well, positive works are empowering works. You are powerful people. Ordinary but powerful. We're ordinary but powerful. It is very much a mindset. That's why it is de-brainwashing, to push away all the negativity, to rid ourselves of that which holds us back, and be very clear and very focused that we do this for ourselves, our families, communities, and indeed the wider society. Because if we succeed, society succeeds as well. Praise be, praise be. So I want to give a few other, a few more of these interesting announcements. So, first announcement, which one could I go to first? Oh yes, let's do the Windrush first of all announcement. Okay. Now, if you are affected by Windrush, now I realise it's called Windrush, okay, but Windrush is simply a banner. It's simply a banner. If you are from Africa, the Caribbean, or indeed from other parts of the former British Empire, okay, and you were born before your countries became independent, okay, and you're here in the UK, in this country, and you don't have your stay resolved, you absolutely have a right to claim compensation if you've been adversely affected. You absolutely have a right to your citizenship. If you were here up and indeed children up until 1972, 73, I understand, you absolutely have a right. Again, if you're from Africa, the Caribbean, or indeed from India, or indeed the Far East, where parts of the British Empire, former British Empire, you have a right, and seek out your rights. So contact the Legal Advice Centre. They're based in the Midlands. You recall I had them here a few weeks ago. And the telephone number to call, it's 07, sorry, I repeat, 07 591 153 828. I repeat, 07 591 153 828. Or you can call 01 902 382 542. Or you can send an email to info@windrushlegaladviceclinic.com. As a sound, there's no spaces. windrushlegaladviceclinic.com. So if you are affected, I urge you to seek out your rights and get your legal rights enforced. Speak to the legal beagles who are there to support you. Okay, really important, really important. I also want to give a big shout out to Ubuntu, Generational Wealth. I've spoken to, let me find the right caption for you. I've spoken to Jose and Teresa. They will be back in the studio in a few weeks' time to give us an update on what happened. I'm told it was an outstanding, thrilling experience, a truly empowering experience. More details in a few weeks' time. Now, I want to give a big shout out, of course, to Dr. Carlton Brown, okay, and of course the Black Entrepreneurs Conference and the Entrepreneurs Business Masterclasses. Okay, for a mere £49, you'll receive advice that will typically be worth thousands of pounds. Let me tell you. So there's a series of masterclasses that you are able to attend if you seek to get into business or have a business and now need advice to get your business up to the next rung of the ladder. I want to positively commend these masterclasses to you. So the masterclass in Manchester on the 10th of April, masterclass in Birmingham in the 18th of April, masterclass in Bristol the 19th of April, and a masterclass here in London on the 3rd of May. If you go to the Eventbrite, you can obtain tickets via Eventbrite. Simply put in UK Black Business Entrepreneur Business Masterclass. There you go. I commend this opportunity to you. It is in partnership with big multinational corporations, okay? And they're there to give you the advice so you can become a wealth creator, an employer, yeah? People, a person or persons who become the cornerstones of your communities. I positively commend these masterclasses to you. Well done, Dr. Carlton Brown and his colleagues. Okay. And lastly, what I also want to do is say this to you, that these shows would not be the same without you. If you're viewing us by YouTube or Facebook, please follow us. Give us the thumbs up. Give us the affirmation. There you are. We do that on screen. Give us the affirmation. Give us the thumbs up. Make a comment via YouTube or Facebook on what you experienced and learned from today's broadcast. That gives the algorithm that drives those platforms the ability to spread the word to a broader range of people. That the attendance levels is going up and up. I'm really very pleased. But we want to extend our coverage, continue to do so. And I hope you found today's show a useful, insightful experience, and one from which, if you are at the birthing stage in your lives, okay, both the women and men, okay, remember, together we can get you through this experience. But if you've had an experience that we should know about, please do not keep it to yourself. Share it with the wider community. Share that with it. And if you're in Southwark, I absolutely want to encourage you to participate in the survey. Share the information with us, because your local politicians who look like us, okay, are there on the front line seeking to effect changes in this aspect of the public services that absolutely needs to get it right. It needs to get it right. But we can only make the difference if you help us to make the difference. Okay? You give us the information, we'll do the heavy work, we'll do the representation, we'll do the advocacy on your behalf. But we need your information, your testimony. It is vitally important. I commend the Southwark Maternity Commission to you. Alrighty, and to the next strong. Those of you on the galaxyfui.net network, I hand over to the next presenter. Let me do that right now. And I wish you all well, and don't forget, participate is to effect change in all of our lives in the Maternity Commission. There you are. I'll disconnect now, and long may you all stay well. Praise be. So, what I will say regards the rest of this show, it is intended that each of these episodes provide useful information that you can use in your lives. And if you can't use it, you share the information with your family and friends. That's the intent. Please do so. Just justify all this effort that we put on to share this information with you. Because together we can and we will make the difference. And if in doubt, I say to you, if in doubt, ask questions. Never suffer alone, because you are never alone. That was always a mirage. You are never alone. So, until the next strong, I remain the motivator. This is where we translate our words into action, and where success is ours for the taking. And that you've got to believe, my people. That you've got to believe. Long may you continue. The Motivator Show. The Black Maternal Death Scandal. Severe maternal morbidity, often referred to as near miss or near death. A study from 2014 shows that compared with white European women, black African women are 83% likely, and black Caribbean women are 80% more likely to suffer a near death. Antenatal care. This is the care you receive while you are pregnant to make sure you and your baby are as well as possible. The midwife or doctor providing your antenatal care will check the health of you and your baby, give you useful information to help you to have a healthy pregnancy, including advice about healthy eating and exercise. Neonatal care. Neonatal means newborn, or the first 28 days of life. Over 90,000 babies are born premature or sick and in need of neonatal care in the UK each year. Perinatal care. Perinatal is the period of time when you become pregnant and up to 1 year after giving birth. You might also have heard of the following terms: antenatal or prenatal, meaning before birth, postnatal or postpartum, meaning after birth. Systematic racism within the UK maternity care. Systematic racism within the UK maternity care is risking the safety of people from Black, Asian and mixed ethnic backgrounds, often with devastating consequences, according to a report by the childbirth charity Birthright. Guardian newspaper article on the 23rd of May 2022. Channel 4 dispatches. Presenter Rochelle Humes demands action over the shocking disparity of maternal deaths between white and non-white women. According to the latest figures discussed in Channel 4 dispatches, Black women are just over 4 times more likely to die during pregnancy and childbirth and up to 6 weeks postpartum. Aired on 8 p.m. on Monday the 29th of March 2021. All-party parliamentary group on black maternal care. The APPG aims to raise awareness of the issue of racial disparities within the maternal health care and offer a solution to this end. Chair, MP Bell Rabo Addy, MP. Vice Chair, MP Caroline Noakes, Conservative. Vice Chair, MP Florence Eshilome, Labour Cooperative. Vice Chair, Kirstin Oswald, MP, Scottish National. Vice Chair, MP Marsha Dakova, Labour. Vice Chair, MP Kim Johnson, Labour. The Southwark Council Maternity Commission. The Commission panel members include Councillor Evelyn Koto, Chair, Professor Dame Donna Kinnair, Co-Chair, Dr. Benedicta Agiwawe Osuri, Omar Campbell, Sandra Igwe, Jackie Kempton, and Cheryl Rhodes. Southwark Council Maternity Commission. Councillor Evelyn Koto, Southwark Council's Cabinet Member for Health and Wellbeing, formed the commission to hold meetings, listening exercises and ways for women and families to share their experiences, raise community awareness about having a safe pregnancy and birth, bring about changes in maternity care to help reduce maternity inequalities such as maternal deaths during pregnancies, provide a message of solidarity to the people of Southwark. Southwark Council Maternity Commission. Who do we want to hear from about maternity care? People living in Southwark who've had a pregnancy in the past 5 years and their families. People who have worse outcomes in pregnancy and childbirth, including those from Black, Asian or minority ethnic backgrounds, white residents on lower income, asylum seekers and refugees, those living with long-term conditions and or disabilities, frontline professionals delivering maternity and or postnatal care in Southwark. The Black Maternal Death Scandal. Get involved. Let your voice be heard. The Motivator Show. The internet's most inspirational podcast. Subscribe to our YouTube channel. It's free. Press the like button and don't forget to leave a comment. Follow us on Facebook. Give us the thumbs up and share with your family and friends. We are also on Instagram and TikTok. Follow us there too. The Motivator Show. Translate our words into action. The internet's most inspirational podcast. The Motivator Show. The Black Maternal Death Scandal. Severe maternal morbidity, often referred to as near miss or near death. A study from 2014 shows that compared with white European women, black African women are 83% likely and black Caribbean women are 80% more likely to suffer a near death. Antenatal care. This is the care you receive while you are pregnant to make sure you and your baby are as well as possible. The midwife or doctor providing your antenatal care will check the health of you and your baby, give you useful information to help you to have a healthy pregnancy, including advice about healthy eating and exercise. Neonatal care. Neonatal means newborn, or the first 28 days of life. Over 90,000 babies are born premature or sick and in need of neonatal care in the UK each year. Perinatal care. Perinatal is the period of time when you become pregnant and up to 1 year after giving birth. You might also have heard of the following terms: antenatal or prenatal, meaning before birth, postnatal or postpartum, meaning after birth. Systematic racism within the UK maternity care. Systematic racism within the UK maternity care is risking the safety of people from black, Asian and mixed ethnic backgrounds, often with devastating consequences, according to a report by the childbirth charity Birthright. Guardian newspaper article on the 23rd of May 2022. Channel 4 dispatches. Presenter Rochelle Humes demands action over the shocking disparity of maternal deaths between white and non-white women. According to the latest figures discussed in Channel 4 dispatches, black women are just over 4 times more likely to die during pregnancy and childbirth and up to 6 weeks postpartum. Aired on 8 p.m. on Monday the 29th of March 2021. All-party parliamentary group on black maternal care. The APPG aims to raise awareness of the issue of racial disparities within the maternal health care and offer a solution to this end. Chair, MP Bell Reboa Addy, MP. Vice Chair, MP Caroline Noakes, Conservative. Vice Chair, MP Florence Eshilome, Labour Cooperative. Vice Chair, Kirstin Oswald, MP, Scottish National. Vice Chair, MP Marsha Dakova, Labour. Vice Chair, MP Kim Johnson, Labour. The Southwark Council Maternity Commission. The Commission panel members include Councillor Evelyn Koto, Chair, Professor Dame Donna Kinnair, Co-Chair, Dr. Benedicta Agiwawe Osuri, Omar Campbell, Sandra Igwe, Jackie Kempton, and Cheryl Rhodes. Southwark Council Maternity Commission. Councillor Evelyn Koto, Southwark Council's Cabinet Member for Health and Wellbeing, formed the commission to hold meetings, listening exercises and ways for women and families to share their experiences, raise community awareness about having a safe pregnancy and birth, bring about changes in maternity care to help reduce maternity inequalities such as maternal death during pregnancies, provide a message of solidarity to the people of Southwark. Southwark Council Maternity Commission. Who do we want to hear from about maternity care? People living in Southwark who've had a pregnancy in the past 5 years and their families. People who have worse outcomes in pregnancy and childbirth, including those from Black, Asian or minority ethnic backgrounds, white residents on lower income, asylum seekers and refugees, those living with long-term conditions and or disabilities, frontline professionals delivering maternity and or postnatal care in Southwark. The Black Maternal Death Scandal. Get involved. Let your voice be heard. The Motivator Show. The internet's most inspirational podcast. Subscribe to our YouTube channel.